Hello, viewers. This is Dr. Amna in front of you, and here I am with a new topic, and that is vaginal birth after cesarean section. आप लोगों में से majority ने ये सुना होगा कि once a cesarean is always a cesarean. But let me tell you the truth. This is not more than a myth. What science says is कि VBAC या vaginal delivery after one cesarean section can be successful in around 80 to 85% of cases. The major concern associated with this myth in people's mind is that there is risk of uterine rupture during labor pains if you had a cesarean section before. Yes, there is a risk of uterine rupture, but this risk is very minute that it ranges from only 0.5 to 1% of cases, which is very minimal. And if we select the patient carefully, that means that we select those patients who had only one cesarean section previously. The cesarean section was done at term, that is after 37 weeks of gestation, and the cesarean section was done in the lower segment of the uterus. It was not done for transverse lie of the baby, and it wasn't done before 7 months of a pregnancy. These patients are good candidates for vaginal birth after cesarean section. So what we need is that we need some extra care for these patients, and that we provide to the patient in the form of one-to-one care. The trained nursing staff is on the floor, and fetal-maternal monitoring is being done continuously, and the theater is ready 24/7 in case any complication arises and we can opt to cesarean section. The main dilemma is that women think that as they have completed their 37 weeks of pregnancy, now it's time to have their baby delivered. But to tell you the exact figure, the time of delivery of the baby starts from 37 weeks and it goes up to 42 weeks. So you have around 5 weeks that the labor pains can start spontaneously or naturally, and you can go into labor, and that kind of labor is destined to be more successful. So do feel motivated for having a vaginal birth after one cesarean section, because it is beneficial for you in terms of cost, in terms of shorter hospital stay, in terms of less blood loss and the need for blood transfusions, and the risk of infections and future fertility. So my recommendation would be that do not hesitate and do have a plan, discuss with your gynecologist, and go for VBAC. If you are a good candidate for VBAC, you are going to make it. Just need patience and motivation. This is Dr. Amna signing off. Bye.